What if I told you that one simple change at dinner tonight could help support healthier blood pressure without adding another prescription to your medicine cabinet? Most people believe high blood pressure is just another unavoidable part of getting older. They blame age, genetics, or stress and assume there's nothing they can do except keep taking more medication. But after years of working with older adults, I've learned that's only part of the story. I'm Dr. Ethan Cole, senior health physician with 15 years of clinical experience. Throughout my career, I've helped patients manage high blood pressure, heart disease, and age-related cardiovascular problems. While medication is often essential, I've also seen how simple daily habits can make a meaningful difference when combined with proper medical care. Today, I'll share 5 science-backed habits that can help support healthy blood pressure naturally. These aren't miracle cures or internet myths. They're practical strategies based on nutrition, physiology, and years of clinical experience. And the final tip is something many people already have in their kitchen but rarely use the right way, so stay with me until the end. Let me begin with a patient whose story has stayed with me for years. A 69-year-old gentleman came to see me after struggling with high blood pressure for nearly a decade. He exercised several times a week, took every medication exactly as prescribed, and honestly believed he was doing everything right. Yet his readings remained higher than we wanted. As we talked about his daily routine, I realized the problem wasn't just what he was eating. It was how his everyday habits were affecting his blood vessels. Once we focused on improving those habits, he gradually began seeing healthier readings alongside the treatment already prescribed by his cardiologist. His experience highlights something many people never hear. High blood pressure isn't always caused by one single problem. In many cases, it's the result of years of gradual changes happening inside your arteries. Think of your blood vessels like flexible rubber tubes. When you're young, they stretch easily every time your heart pumps blood. That flexibility helps absorb pressure and keeps circulation running smoothly. But with age, those vessels naturally become stiffer. Years of inflammation, oxidative stress, and everyday wear reduce their ability to expand. As the arteries lose flexibility, the heart has to push harder to move blood throughout the body. That's when blood pressure slowly begins to rise. One of the biggest reasons this happens is chronic inflammation. Unlike an injury you can see or feel, chronic inflammation develops quietly. It slowly irritates the inner lining of your arteries over many years. You won't notice pain, swelling, or obvious symptoms, but inside your body, those blood vessels become less efficient little by little. This is why your daily food choices matter so much. Every meal sends signals throughout your body. Some foods help calm inflammation and support healthy blood vessels. Others encourage inflammation and make your cardiovascular system work harder than it needs to. No single meal will transform your health overnight. But your daily habits, repeated month after month and year after year, can have a powerful impact on your heart. That's why I always encourage my patients to stop thinking of food as simply calories. Instead, think of every meal as an opportunity to either support your heart or place more stress on it. Now let's begin with the first habit. Most people start their meals with bread, rice, pasta, or potatoes. Instead, I want you to try something different. Eat your vegetables first. It may sound too simple, but there's a very good reason. Vegetables are naturally rich in fiber, and fiber slows the digestion of carbohydrates. Instead of causing a rapid rise in blood sugar, your meal is absorbed more gradually. Why is that important? Large spikes in blood sugar trigger larger releases of insulin. Over time, repeated insulin surges can place extra strain on your blood vessels and make it harder for your body to maintain healthy circulation. Starting your meal with vegetables helps slow that process. Many people also notice they feel satisfied sooner, making it easier to avoid overeating without feeling deprived. Here's an easy way to remember it. Vegetables first. Protein second. Carbohydrates last. You're not removing your favorite foods. You're simply changing the order in which you eat them. It takes almost no extra effort, yet it can become one of the easiest heart-healthy habits you'll ever develop. And that's only the first step. In the next part, I'll explain why one inexpensive ingredient sitting in millions of kitchens has become the focus of growing research, and how using it correctly may help support healthier blood sugar, circulation, and blood pressure naturally. Now let's move on to the second habit, one that's probably already sitting in your kitchen: apple cider vinegar. Over the last several years, researchers have explored how the acetic acid in apple cider vinegar may help support healthy blood sugar levels after meals. Why does that matter? Because large blood sugar spikes can place extra stress on your blood vessels over time. When used correctly, apple cider vinegar may become a simple addition to an already healthy lifestyle. If your healthcare provider agrees it's appropriate for you, mix 1 to 2 tablespoons into a full glass of water and drink it with a meal. Never drink it straight. Undiluted vinegar can irritate your throat, upset your stomach, and gradually damage your tooth enamel. If you have acid reflux, stomach ulcers, kidney disease, or take medications that affect blood sugar or potassium levels, always check with your doctor first. Now let's talk about something you can eat just before bedtime. Walnuts. This small snack delivers healthy fats, antioxidants, and plant-based omega-3 fatty acids that help support normal blood vessel function. Walnuts also contain L-arginine, an amino acid your body uses to produce nitric oxide, a natural compound that helps blood vessels relax. As we grow older, our bodies produce less nitric oxide, making healthy circulation more difficult. A small handful, about 30 grams, around half an hour before bed is all you need. Combined with a balanced diet, it's an easy habit that supports heart health while you sleep. Speaking of sleep, here's something many people never realize. Your blood pressure isn't supposed to stay the same all day and night. In a healthy body, it naturally drops during sleep, giving your heart and blood vessels time to recover. But for many adults over 60, that nighttime drop becomes much smaller. The heart continues working harder than it should, even while you're asleep. That's one reason why a consistent bedtime routine, quality sleep, and healthy evening habits are so important for long-term cardiovascular health. Now let's move on to one of my favorite drinks, hibiscus tea. Its deep red color comes from powerful antioxidants called anthocyanins. These natural compounds have been studied for their ability to support healthy blood vessel function and maintain normal blood pressure as part of an overall healthy lifestyle. If you enjoy herbal tea, drinking 2 to 3 cups a day without added sugar can be a refreshing choice. If you prefer a little sweetness, use only a small amount of honey. However, if you're already taking medication for high blood pressure, speak with your physician before making hibiscus tea a daily habit. Now, I want you to check one last thing after this video. Open your kitchen cabinet and look at the cooking oil you use most often. The type of fat you cook with matters more than many people realize. Instead of relying heavily on highly processed cooking oils, consider using extra virgin olive oil for everyday meals. It's naturally rich in heart-friendly monounsaturated fats and antioxidants that support healthy blood vessels. For most home cooking, it's one of the best choices you can make. Now, let's quickly review today's 5 habits. First, eat vegetables before the rest of your meal. Second, if your doctor approves, use diluted apple cider vinegar with meals. Third, enjoy a small handful of walnuts before bedtime. Fourth, consider adding unsweetened hibiscus tea to your daily routine. And finally, replace heavily processed cooking oils with extra virgin olive oil whenever possible. Notice something all 5 habits have in common. They're not designed to replace your medication. They're designed to support your body's natural ability to maintain healthy blood vessels, reduce unnecessary inflammation, and improve overall cardiovascular health. That's the goal. Not perfection, but steady progress. If there's one thing I'd like you to remember from today's video, it's this. Small habits practiced consistently are often more powerful than dramatic changes that only last a few days. So don't try to change everything tonight. Choose just one habit and commit to it for the next week. Once it becomes part of your routine, add another. That's how lasting health improvements happen. If you found this video helpful, let me know in the comments which habit you're going to start first. I genuinely enjoy reading your experiences, and your story could encourage someone else to take that first step. And if you're looking for practical, evidence-based health advice to help you stay active and independent as you age, make sure you subscribe and turn on notifications so you don't miss our upcoming videos. I'm Dr. Ethan Cole. Thank you for spending these few minutes with me. Take care of your heart, take care of yourself, and I'll see you in the next video.